Zaynab Nafees, and I'm a PhD student at McGill University in the Commissure Lab. So we're gonna start right away. I'm gonna talk about health outcomes. Health outcomes refers to an aspect of a person's health that can be intentionally influenced by interventions or external factors affecting their physical, emotional, mental, or social well-being. So for instance, this is on the right-hand side, you can see the picture. This is a study by Bouchard et al., and they use the International Classification of Functioning, Disability, and Health, so the ICF, to explore the effects of physical, emotional, and cognitive impairments on the intrusiveness of illness in individuals with multiple sclerosis. And so the study revealed complex relationships, which is visualized in this path analysis diagram, showing how these factors interact. And so the ultimate outcome, illness intrusiveness, is depicted as a hidden variable, highlighting the intricate interplay of health influences. Now, objects have basic properties essential for understanding them. We have length, how long an object is, mass, the amount of matter, time, event progression, electric current, the charge flow, temperature, hotness or coldness, luminous intensity, the brightness of light, and the amount of substances, so the quantity of entities like atoms. So these properties are the foundation for the scientific measurements and create the International Systems of Unit, the SI, which is a standard way to measure things in different scientific areas. But what about properties of people? People, like objects, have various properties that fall into different categories, making human nature complex. So physical properties cover things like height, weight, age, and biology. And psychological properties involve thinking, personality, and emotions. Social properties include interactions, relationships, and societal roles. The cultural background, values, and beliefs also make individuals unique. And so these human properties are dynamic and connected, and they form one's identity and affecting responses to the outside world. And so recognizing and understanding these diverse human properties is important for empathy, effective communication, and a comprehensive approach to individual well-being. So what should we measure in health? In Kerr-White's model, assesses the health through 5 dimensions. So death, disease, discomfort, disability, and dissatisfaction. And these aspects cover different aspects of well-being influenced by intentional actions or external factors. The model focuses on preventing premature loss of life, managing illnesses, easing physical or emotional discomfort, addressing limitations in abilities, and improving overall well-being. It also considers destitution, recognizing the impact of broader factors like economic and social conditions on health. And so this model provides a simple framework for understanding and measuring health, guiding interventions to promote well-being and address specific health concerns. So what are outcomes now? Health assessment outcomes cover various aspects of well-being, including mortality, morbidity, disability, symptoms, functional status, satisfaction, and cost. This comprehensive approach explores physical health, personal happiness, and economic implication. And patient reported experiences also provide valuable insights, enhancing the evaluation of health outcomes with individual perspectives and satisfaction. Now, what are pros, SROs, clinicals, and techos? So patient-reported outcomes are directly reported by patients and cover symptoms, their intensity, impact, and bother. They include functional aspects like mobility and physical functions with claims not modified by others. Pros differ from SROs, self-report outcomes, because they rely solely on the individual's report without external verification. And verification becomes important, especially when assessing abilities like driving after certain health conditions. Observer-reported information notes behaviors without attributing them to specific health conditions, and clinician-reported outcomes involve clinicians observing and rating physical signs. Performance tests assesses physical and cognitive ability and cognitive abilities, and technologically assessed outcomes, TECOs, use emerging technologies like wearable devices for capturing physical activity and movement-related parameters in symptom assessment. So in pediatric surgery, we look at people's characteristics in 2 ways: objectively considering measurable factors and subjectively acknowledging individual thought and experiences. However, the terms objective and subjective are sometimes misunderstood, suggesting accuracy for the first and bias for the second. And so this creates a challenge, especially when we don't have personalized measures for patients' outcomes and experiences in pediatric surgery. And so the gap that I'm really trying to fill is for a better understanding of how surgeries affect children. And this involves recognizing both the clinical results and the personal experiences of young parents of young patients and their families, as emphasized by Anne-Sophie's scoping review and Julia's scoping review. These are two lab members in these are our previous lab members. And so Anne-Sophie's systematic review showed that PROMs are increasingly used in pediatric surgery. Disease-specific PROMs predominate the field, yet validated, especially individualized PROMs, are notably absent. And Julia's systematic review showed that although PROMs are increasingly used in pediatric surgery, PREMs are not yet in use, being typically substituted by satisfaction service. And so to enhance the pediatric surgery, a comprehensive solution is proposed. First, we suggested creating a custom survey for the Montreal Children's Hospital based on a UK model, making it usable. And secondly, we propose using an individualized measure called a patient-generated index, PGI, which I will go into it further. And so children would rate the 5 most affected areas of their health conditions. And so integrating PGI with standardized surveys aims to better understand children's experiences. And we interviewed children using different surveys, EQ5D, PROMIS, MyMop, and I'll get into them later, to align with PGI, creating a unified tool to assess children's quality of life post-surgery. And so this approach, the GAP, motivated outcomes and experiences and ensured a thorough patient-centered evaluation, improving the accuracy of outcomes in pediatric surgery. And so to fill the gap where patient-reported experience measures were missing in pediatric surgery, we published a paper. Is in the process of publishing. We published a paper introducing a tailored PREM based on the PREM UK instrument. And so the Canadian PREM, specifically designed for children at the Montreal Children's Hospital, addressed the absence of such measures in this context. And the study highlighted that by integrating the perspectives and preferences of children and young people into clinical practice, the newly developed PREM has the potential to enhance the delivery of patient-centered care for this vulnerable population. And it also emphasized the importance of recognizing and acknowledging the unique needs and voices of children and young people for a more responsive healthcare approach. And so for our second paper, we will address the gap. The gap in a way that we aim to check if using the patient-generated index, PGI, as an outcome measure in pediatric surgery is feasible and practical. So this involves assessing its suitability for pediatric patients, discussing the evidence supporting its use, and exploring the logistics of distributing and completing the PGI. So we're going to compare it with measures like MyMop, EQ5DY, and PROMIS, and consider clinicians' perspectives on usability. The identified gap in the absence of an individualized patient-reported outcome measure, leading us to use the PGI for this purpose. And so the main goal of this paper is to provide evidence that the PGI is well suited for measuring what matters to children and young people who have undergone surgery for neonatal visceral conditions. So let's briefly overview the neonatal visceral conditions. Children and the young people are affected by the congenital diaphragmatic hernia, CDH, esophageal atresia, EA, Hirschsprung disease, HD, and imperforate anus arm. So Hirschsprung disease is a congenital condition where nerve cells are missing in the myenteric plexus of the bowel, as you can see, and leading to impaired bowel motility. And so symptoms and severity vary, ranging from acute intestinal obstruction in newborns to delayed meconium passage, chronic constipation, and abdominal issues. And so complications may include Hirschsprung-associated enterocolitis, which is HAEC, requiring urgent attention. And the diagnosis involves x-rays and rectal biopsy with treatment including antibiotics for HAEC and surgical removal of the affected bowel segment. And so despite potential long-term bowel function challenges, most patients can lead normal lives after corrective surgery. For the diaphragmatic hernia, this is a congenital defect with a hole in the diaphragm, allowing organs to move into the chest, affecting lung development and causing breathing difficulties at birth. And about 1 in 3,600 babies are affected with a diaphragmatic hernia, often associated with other conditions. And so while the specific causes are not yet fully understood, genetic factors may play a role. And prenatal screening, including ultrasounds, can detect it, or it may be diagnosed after birth with difficulty breathing. And surgery is a main treatment performed shortly after birth, followed by respiratory support for lung recovery. And so understanding risks and causes, support strategies for healthy pregnancies with pregnant individuals, encouraged to consult with their doctors. Now, esophageal atresia is a congenital defect where part of a baby's esophagus doesn't develop correctly, preventing the upper and lower parts from connecting. And so this makes it challenging for the baby to pass food to the stomach, sometimes causing breathing issues. And it's often linked with tracheophageal fistula. It comes in 4 types, with type C being the most common. And the occurrence is around 1 in 4,100 births in the US and can happen alone or with other defects. And so while the causes are mostly unknown, genetic factors may contribute, and older paternal age and assisted reproductive technology have been linked to an increased risk. The diagnosis usually occurs after birth when feeding difficulties are noticed, and surgery is required to reconnect the esophagus for normal breathing and feeding. And early detection and intervention are essential for effective management. Anorectal malformation are congenital defects affecting the development of the anus and rectum in newborns, occurring about 1 in 4,000 births, and they can range from mild to complex, involving issues like a narrow anal passage and membrane over the anal opening, imperforate anus, or abnormal connections, fistulas to other structures. Symptoms vary, but common challenges include constipation, hindered bowel movements, and in some cases, urinary infections. The cause is often unknown, but genetic factors or other congenital defects may play a role. The diagnosis involves physical examination and imaging studies. Treatment usually requires surgical interventions with the specific procedures tailored to the severity and type of malformation. And ongoing management may be needed to address associated concerns like bowel and bladder function. So the study's specific objectives are outlined as follows. Firstly, we're going to employ the Voyant tools in identifying areas of function and health that a selected group of target respondents deem important for their quality of life. Secondly, we're going to assess the alignment between existing measures of pediatric quality of life and the content identified as important by the targeted respondents. Third, we're going to delve into the cognitive processes employed by the target respondents when completing the 3 steps of the PGI. And lastly, we're going to discern clinicians' perspectives regarding the usability of these measures in capturing the relevant aspects of pediatric quality of life as perceived by the target population. So we're going to use a mixed method design to assess the quality of life in children and young people following surgery for neonatal visceral conditions. The study focused on identifying life domains for potential enhancement in children and young people with specific congenital conditions, so CDH, E8, HT, and ARM. And to measure outcomes, a combination of standardized and disease-specific prompts were selected based on the identified domains. The inclusion criteria encompass children aged 0 to 17 who underwent surgery for the specific conditions at the Montreal Children's Hospital between 2005 and 2022, along with the inclusion of their parents in the study. So these are the 4 prompts that we have used. Patient-generated index. This is a patient-reported outcome measure, allows individuals to identify and rank health-based concerns based on their perceived importance. The pediatric measure yourself medical outcome profile, so MyMOP, is a self-report tool that enables children to identify and assess their own health outcomes in areas they consider significant. The EQ5DY is the standardized measure for assessing health-related quality of life in children and adolescents and provides a descriptive profile and overall health rating. And then the PROMIS, the patient-reported outcome measurement information system tool, is designed for pediatric populations, capturing a range of health-related quality of life domains through short-form surveys. And so the study used individualized prompts to pinpoint domains of significance as ranked by both patients and parents. The top 10 domains identified for each specific condition served as a foundation for the selection of prompts that align with the concerns of both CYP and their parents. And to ensure a comprehensive and co-developed survey for each condition, a consensus approach was adopted involving active collaboration with patient partners in the selection process of prompts. And this approach aimed to capture a well-rounded perspective, integrating the unique experiences and priorities of patients and their parents in the evaluation of health-related outcomes. So the study employed the International Classification of Functioning, Disability, and Health, ICF, as a framework to investigate various aspects of functioning, disability and health related to relevant to children and young people post-surgery. And so to delve into the linguistic nuances and patterns with the data, the Voyant tools were utilized for linguistic analysis, and the content analysis using the ICF involved categorizing specific areas into a comprehensive set of categories with particular focus on functioning and disability components. And so this systematic approach aimed to provide the detailed examination of the multifaceted aspects of CYP's post-surgery experiences, offering insight into their functional abilities, disabilities, and overall health status within the context of the ICF framework. So child participants meeting eligible criteria were identified to thorough examination of medical archives, and OASIS consultation was employed for verification of eligibility. The healthcare team reached out to families, telling them about the study details and extending invitation for participation following implied informed consent. And the determination of the sample size was rooted in surgical and clinical records, and surveys were administered over the course of the year from January 1st, 2023 to December 31st, 2023. And this methodological approach aimed to ensure a comprehensive and verified selection of participants, providing a reliable basis for the study's investigations into the health-related experiences of the identified child cohort. So the 4 prompts, PGI, MIMOP, PQ5D, and PROMISE, were compiled with input from patient partners, and the selection of instruments and survey questions was guided by a consensus method, aligning closely with prioritized life domains. And this approach aimed to ensure a comprehensive understanding of the health-related experiences and outcomes for the identified cohort. The Voyant tool was utilized to analyze text data by identifying both the total number of words and unique word forms. So unlike combining similar words, Voyant tools enables the identification of word forms using the word feature. So for example, it counts sleep and sleeping as a single word form and post-processes the grouping of terms like activity and activities. And the tool also categorized terms related to different sports under a unified category. The Voyant tools provided the option to view each word in context, such as combining climbing with stairs without treating climbing separately. And so the analysis involved counting and comparing the number of common words among children and employing rate ratios and 95% confidence interval for the assessment. So in this study, directed content analysis was employed to align the nominated areas with the WHO's ICF. So the ICF is recognized as a prominent model for delineating function, disability, and health. It boasts a hierarchical coding structure, and so previous research, such as the work by Cuspiner et al., focused on the textual mapping of content from PGI to the ICF. And so really the ICF served as a valuable tool for mapping items from standardized measures, providing evidence for content coverage. And 4 authors, this is ongoing right now, assume the role of raters, systematically aligning nominated areas with the categories of the ICF. 2 raters operated independently, myself and Nikki, categorizing areas into body functions, so B codes, structures into S codes, and activities and participation in D codes, with discrepancies resolved by a 3rd grader. And the 4th rater is going to conduct a comprehensive review and revision of the decision. The functioning and disability section of the ICF encompass components such as body function, structures, and activities or participation. Activities or participation because the participation is only in the ICF and it's not in the Wilson-Cleary model. So chapters within the activities or participation component included diverse domains like learning. So here are the results. This is as you can see on the far left, these are the text threads, the domains that children have identified and they have scored. So each column, each domain is associated with their respective rating. So the middle portion is a rating out of 10, 0 being the worst you can imagine, 10 being the best, and the next columns are the points that are associated. So the gold coins that they've given to like, for example, not eating what I want. So they scored 6 out of 10. So it affected them the most. And then they gave 4 coins out of 12 to make that go away or considered important. And the way I calculated the quality of life is you would take the score out of the 10 and you would multiply it by how much they gave the gold coin out of the 12. And once you had that, you would average the whole thing and you would get a quality of life score. You multiplied by 10. And in this case, we can see participant 7 has a quality of life score of 50.83. And so in the assessment of health concerns, participants assigned both importance ratings ranging from 0 to 12 and severity ratings ranging from 0 to 10. The concerned drink and eat what I want received a low importance rating of 1, which highlights its insignificance, and severity ratings exhibited variability, exemplified by the concerned health, which received a severity rating of 0, indicating it was considered less severe. So to further symbolize the perceived importance and severity of each concerned, participants allocated points, providing an additional layer of representation for the significance and seriousness attributed to individual health-related issues. So then I took all the threats and I grouped them, based on severity. So you can see eat quickly, friendship, studies, sport is deemed these are the most severe, and dislike endoscopies and appointments received low severity ratings. So these states were considered undesirable. So particularly among children, there was a discernible trend of assigning low ratings to states associated with their respective medical conditions, which underscores the negative impact or discomfort associated with these aspects of their health. Participants also were instructed to allocate 12 spending points or tokens among the nominated areas with the number of tokens indicating the priority areas they most wish to improve. So areas such as regular checkups, blood tests, and tracheostomy received more coins, signifying their heightened importance. Drink and eating received fewer coins, which indicates a lower priority for involvement. And so this distribution suggests that participants, particularly children, expressed a strong desire to enhance aspects related to medical procedures and health monitoring, emphasizing the significance of these areas in their aspirations for improvement. So on the left-hand side, I have the topics sorted, and on the right-hand side, I have the topics frequency. So the PGI involved the identification of 20 distinct topics from 17 interviews condensed into 59 text threads, with a predominant focus on impairment levels, particularly GI concerns. And so weight gain emerged as a prominent topic, sparking discussions on potential links to inactivity, treatment modalities, or medication side effects. And so the analysis of these text threads mapped to the ICF categories revealed that burden of care was the most frequently mentioned quality of life concern, and participants consistently shared narratives related to hospital visits, multiple surgeries, appointments, and various tests. And so the topics were categorized based on impairment levels, encompassing domains such as EGI, endocrine energy, head and neck immune, physical activity, psychological, respiratory, and skin impairments. With impairment and the health condition GI being the most prevalent ICF domain identified. So it's noted that PGI scores are generally lower compared to other quality of life measures. And so this discrepancy is there because PGI scoring is agnostic to specific areas and is solely based on severity and priority for improvement, indicated by the spending points. The concept underlying the PGI is individualized measurements where individuals nominate only the areas of most significant impact on their lives. In contrast, the fully standardized measures may include areas unaffected by the respondent, potentially raising their overall score. So the lower PGI values reflect a more personalized assessment, capturing specific aspects deemed most important to individual well-being. So in addition to category coding, a comprehensive text analysis of the entire corpus was conducted using Voyant tools. And so the term eat appeared 7 times, followed by the word sick. And so the use of word and word form identification through this analysis revealed the nuanced linguistic variation in how different children articulate their health-related experiences. And so this approach is not only quantified the frequency of specific terms, but also offered a deeper understanding of the diverse ways in which children express their encounters with health-related aspects within the corpus. So the study adopted a 3-fold approach to assess its measures. Initially, it evaluated the alignment of the PGI with established quality of life measures such as EQ5D, PROMIS, and IMOP. And subsequently, cognitive debriefing, we will do this, will involve approximately 10 patients that will provide us insights into the clarity and relevance of the PGI. And in the upcoming stages, our plan is to have clinicians' perspectives on the usability and the validity of the PGI, along with comparison measures, which is going to give us a professional viewpoint for a comprehensive assessment of the study's measure in the context of pediatric surgery. And so there are certain limitations. The sample size is limited, potentially impacting the broader applicability of the findings. The specificity of the chosen sample for their adds a layer of consideration, as the study's results may primarily reflect the characteristics and experience of a particular subgroup, limiting generalizability. And the extent of parental involvement in the study may influence the comprehensiveness of insights, so given their pivotal role in pediatric care decisions. And so while these limitations are acknowledged, efforts will be made to extract valuable and contextually relevant insights within the design framework. So incorporating children's voices in pediatric surgical care enhances patient-centeredness, improves decision-making, and bridges the gap between children's and parents' perspectives for more accurate and meaningful healthcare outcomes. I'll be glad to take any questions.